Greetings, everyone, and welcome again to our Community Health Talks. As you know, Columbus Regional Healthcare System has started to be very important for us to still interact with our community and have discussions about specific health topics that provides information about things that you are concerned about and just want to know. Today, we have the privilege of talking to two of our very esteemed doctors here in our organization about COVID-19 and the vaccine. So it's be a pretty interesting conversation today. So join in with us as we dive into this topic. If Dr. Al-Khateeb can introduce himself first, and then Dr. Pulkingham can follow him.
Hey everyone, I'm Dr. Al-Khateeb. I'm one of the internal medicine physicians here in Columbus Regional Hospital. I've been practicing for almost 3 years here as a hospitalist.
I'm Dr. Nathan Pulkingham. I am the Director of Laboratory Services and the pathologist here, and I've been here for several months and covered here off and on for a few years, but been in practice elsewhere in the state for over 2 decades. So anyway, it's a pleasure to be here.
All right. Glad to have both of you here joining us today. My hospital recently, this week, has had the opportunity to get vaccine here. And we're pretty excited about that. But as soon as the vaccine got here, you can imagine there were a lot of questions that have been kind of going around in our community about the vaccine. So one of the questions that we would like to offer up is, what are the possible side effects? I guess the immediate side effects and the short-term side effects that could possibly happen to an individual that takes the vaccine.
Well, there are immediate effects that have been identified in a very, very, very small patient population, and that is why we are observed for 15 minutes after the injection occurs. There's a population that are hypersensitive or hyperallergenic, have severe allergies that have a anaphylactoid or anaphylactic reaction, and that's why you're observed. But it's very, very it's very few in number, and they were initially, that group was excluded from the from the study, so that's why it's only now being discovered. But they are ready for it and easily treatable if that were to occur, but it's very, very rare occurrence.
Thank you for offering that. So why is it necessary for the vaccine to be kept cold?
It is a very delicate nucleic acid, or the messenger RNA. It's easily degraded at room temperature beyond a certain point. That's why it has to be injected soon after it comes from a frozen state. But that's why it is frozen, is how it is preserved. And part of that is a chemical reaction which can degrade the RNA, and chemical reactions have optimal temperatures or ideal temperatures at which they occur. And the colder it is, the more likely you will literally freeze a chemical reaction and not allow degradation to occur.
Wow. So, Dr. Al-Khateeb, we've noticed that many people are concerned about how quickly this vaccine has become available. Could you explain how this happened and what should we be concerned about that?
Sure, I'd love to, Jeremy. So when it comes to vaccines, most of the companies work on multiple vaccines at once. And so they go through phases, and these phases go in order from the beginning to the end. Now, this virus has been life-threatening. It's basically taken over most of the world. And so these vaccine makers had to work really quick to get this going, and they didn't skip any steps. They just put all their resources into making this vaccine, and so they were able to do it quicker than normally expected.
Thank you, Dr. Al-Khateeb. So
Yeah,
there's been a lot of rumors about, I guess, what could potentially happen if someone takes the vaccine. And one of the rumors that's been going around is that it causes Bell's palsy.
sure.
Can you speak to this, Dr. Al-Khateeb, and any other, I guess, side effects that could potentially happen?
Sure, I'd love to. So I have the meta-analysis in front of me, and I was reviewing it just before getting on this interview. And the study showed that there were about 38,000 participants in the vaccine, and about 4 of them had Bell's palsy, which have recovered from Bell's palsy. Now, Bell's palsy is something that occurs in nature, and a lot of times it's caused by a virus that gets reactivated. And in nature, we've noticed that about 15 to 20 people per 100,000 naturally get this without any interference from a vaccine. And so if you were to correlate that number to 4 out of 38,000, it would be almost the exact same amount. So it's unlikely that this virus caused these individuals to get Bell's palsy. Rather, it's something that would have occurred anyways.
Wow. Okay.
Uh,
So Dr. Pulkingham, I guess one of the concerns to a question that we wanted to offer up was in regards to the flu shot. So if a person can't take the flu shot due to an allergy, could they be able to take this vaccine? Is there anything that we should
They should, yes, they should easily be able to do the mRNA vaccine, because the flu shot and allergies oftentimes egg related. The influenza virus is produced, propagated, and proliferated, grown, and on an egg substance as the building block, and so there are allergies to eggs that exist in the population. This mRNA is not a piece of virus itself. It is a substance that our own body, our nuclei within our cells produce, that then goes out into the cytoplasm for protein synthesis. So it encodes for protein synthesis. And what happens is that occurs, and it's producing that spike or part of the protein that instead of the entire viral particle, just the spike or attenuated a virus. And so that's and our body will sense this as a foreign protein and cause an immune reaction, and so that subsequently, when we would encounter the real virus, our immune system will react and repel and nullify the virus, attack it in hopes that it will prevent the outright disease.
So if somebody took the flu vaccination, that does not make them safe or free from obtaining, I guess, COVID. We need the COVID vaccination.
Oh yeah, the COVID. They are two different viruses entirely. Yeah,
absolutely. Absolutely. So Dr. Al-Khateeb,
yes.
So, I mean, we've seen a lot of people kind of going back and forth about wearing masks, and you know how some groups say we don't need to wear masks, don't protect us, and other groups arguing saying that we should wear masks. So we've heard that after taking the vaccine, we are still kind of asked to continue to wear a mask.
Hmm.
Why is this? Why do we still need to wear a mask after taking the vaccine?
Well, the COVID virus is a virus that is very that has swept through the nation and caused lots of morbidity and mortality. And I've dealt with this firsthand. It's a horrible virus to get, and a lot of individuals don't do well with it. Although with our treatment, people are getting better. But the most important thing is prevention at this time. We got the vaccine out, it's 95% or so effective, but that's still not 100%. And you don't want to have 1 in 20 chance of getting the virus still. And so we'd still recommend continued usage of a mask. We still recommend continuing washing your hands. But it's the same when it comes to all other viruses. Even when you get the flu vaccine or any other vaccine, we recommend you still wash your hands, you still take precautions, because prevention is much better than just trying to go for a cure. And in this case, there is no cure, but there is prevention and there's treatment. And so wearing a mask would be very very crucial, not only for yourself but also for others, in case you're carrying it and you're asymptomatic, because you can go home and take it to your grandmother or someone else who may be less fortunate and will succumb to the disease. So continued use of a mask is extremely important.
Wow, thank you for sharing that.
Mhm.
So I've taken the vaccine. I took it yesterday. I'm, I guess, 24 hours removed from taking it. It
Mhm.
was a very simple process, kind of similar to getting the flu vaccination. It, in my experience, it feels kind of like the tetanus shot,
Mhm.
because my arm's a little sore, but beyond that, nothing else. I feel fine. I feel like my normal self. Have you taken the vaccination yet?
I
Or
have.
do you
I
plan on taking it?
flu and the COVID. I got it 2 days ago also, and did not feel a thing at the time of. But overnight, my waking up the next morning yesterday, I felt like the arm was sore in that area, like someone may have punched me in the
Yeah.
arm. But that's now gone today, so that was just a 24-hour nuisance, very minimal, mild. Uh,
Good.
It's on my calendar, Jeremy. I really want to get it done as soon as possible. I just haven't had the privilege to have time to go get it done. But
Absolutely.
hopefully today, after seeing my patients, if I have 20, 30 minutes to spare, I'll definitely go get it, because
Sounds good.
definitely need to get some protection.
Yeah. So this
Yeah.
question is for both of you all. So if you were speaking to someone right now who
Mhm.
is kind of debating whether or not to take it, what would you tell them? Like, what kind of counsel would you give them? Both of y'all.
I'll let Dr. Pulkingham start with this one, and I'll go after him.
I would say that it is important to get it because it is our only collective societal chance of herd immunity. In other words, having enough people who have built up immunity, whether naturally acquired, but that is risky by the very fact that you don't know how severe you're going to come down with it. Some people have no comorbidities or risk factors, yet don't do well with it. So you cannot rely on getting it naturally, and that doesn't necessarily need to provide robust immunity, and we don't know for how long. Uh, the 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 beauty of this vaccine, the mRNA, is that encoding for a certain part of the spike protein disables it far more effectively. And so, if everyone were to get that kind of protection with vaccination, we can end this pandemic. But it will take time and enough of us to get that level of protection so there isn't inadvertent or tangential spread out in public.
And I completely agree with Dr. Polkingham. I've taken care of many patients with it, and it's a horrible virus to have. getting the vaccine is not only for you, but it's also for your loved ones and for the community too. Like Dr. Pulkingham said, if we have enough people getting vaccinated, we will get a herd immunity, which will lead to individuals, which will lead the pandemic to end, and we can go back to our normal life before COVID-19 ever started. And so many people have been vaccinated now. Side effects are minimal. And I think the benefit is great for not only you, but for others too, other loved ones around you.
Absolutely.
So get the vaccine if you can.
Absolutely.
Mm-hmm.
Well, I just want to thank you guys again for joining us on
Sure.
Community Health Talk. We may have to come back and ask more questions as more people take the vaccine. They may have more questions they want to offer up. But
Bring it
thank
on.
you again.
Bring it on.
Yes, sir. Pleasure to
You
be
know,
here. Thanks. Let us
take care.
know.
Y'all
All
take
right.
care. All right.
You
All
too. Thank you.
Bye.
All right.